Welcome to today's episode of Med Madness. In this episode, we'll cover several important but concise topics: atrial flutter, bradycardia, long QT syndrome, pulmonary embolism, and hyperkalemia. We'll break down each condition, discussing their definitions, causes, pathophysiology, symptoms, diagnosis, management, and treatment options. Let's dive in. First, let's talk about atrial flutter. Atrial flutter is a type of arrhythmia characterized by a rapid, regular atrial rate. On the ECG, it shows saw-toothed flutter waves. The atrial rate is approximately 300 beats per minute. The ventricular response can be constant or variable, leading to either a regular or irregular rhythm. Next, let's discuss the pathophysiology. Atrial flutter involves a re-entrance circuit in the right atrium, particularly around the cavotricuspid isthmus. Risk factors include age, hypertension, heart failure, and post-cardiac surgery. Clinical implications include a thromboembolism risk similar to atrial fibrillation and the use of the CHA2 DS2-VSC score for anticoagulation therapy. Moving on to management, anticoagulation is indicated for high-risk patients. Rate control can be achieved with medications such as metoprolol or verapamil. Definitive treatment options include radiofrequency ablation or electric cardioversion. Next, let's discuss bradycardia. Bradycardia is a slow heart rate, typically below 60 beats per minute. It may result from sinus node dysfunction or blockage of the electrical signals. Symptoms of bradycardia include fatigue, lightheadedness, and syncope. Diagnosis is based on clinical symptoms and ECG findings. Management of bradycardia starts with initial management, such as IV atropine for unstable patients. If instability persists, temporary pacing or infusion of dopamine or epinephrine may be necessary. It's also important to investigate underlying causes, which can include sinus node dysfunction, acute myocardial infarction, or medication toxicity. Next, let's explore long QT syndrome. This condition is characterized by a prolonged QT interval on ECG, predisposing to torsade de pointes. Causes of long QT syndrome can be acquired, such as medications and electrolyte abnormalities like hypomagnesemia, hyperkalemia, or hypercalcemia, or congenital due to genetic mutations affecting potassium channels. The pathophysiology involves impaired function of voltage-gated potassium channels, delaying repolarization. Symptoms include syncope and sudden cardiac death, especially during periods of rapid heart rate. Management includes avoiding exacerbating factors, maintaining normal electrolyte levels, and avoiding QT prolonging medications. Beta blockers can reduce the risk of syncope and sudden cardiac death. High-risk patients may require an implantable cardioverter defibrillator. Next, let's discuss pulmonary embolism. This is a blockage in one of the pulmonary arteries in the lungs, usually due to blood clots. Common symptoms include pleuritic, chest pain, dyspnea, tachypnea, tachycardia, cough, hemoptysis, and lower extremity pain or swelling. For diagnosis, a chest X-ray is often normal but can show non-specific findings. The gold standard for confirmation is chest CT angiography. Management involves immediate anticoagulation therapy and supportive care. Finally, let's discuss hyperkalemia. Hyperkalemia is characterized by elevated potassium levels in the blood, typically greater than 6.5 milliequivalents per liter. Symptoms include lethargy, muscle weakness, and cardiac arrhythmias. ECG changes occur in stages. Stage 1 shows a prolonged PR interval and tall peaked T waves. Stage 2 involves the loss of P waves and ST segment depression. Stage 3 shows a widened QRS complex, and Stage 4 can lead to asystole. Urgent treatment includes immediate actions such as calcium gluconate and insulin plus glucose. Potassium can be removed using patyrema for stool, diuretics for urine, or hemodialysis for blood. That concludes today's episode of Med Madness. We've covered atrial flutter, bradycardia, long QT syndrome, pulmonary embolism, and hyperkalemia. Make sure to take the combined quiz to test your understanding. Stay tuned for our next episode where we continue to explore essential medical topics. Thanks for listening.